All right, this is the last section of blood notes, and it's on blood vessels. So we'll go through arteries and veins and things like that. Arteries, they carry blood away from the heart. So kind of remember like artery starts with A and away starts with A, just to help you remember it. As far as this, they have like smooth muscle to contract. The vasoconstriction is the contraction of smooth muscles, and it helps save like body heat. It increases blood pressure. Vasodilation is the relaxing or relaxation of smooth muscle. It releases the body heat and lowers the blood pressure, so the opposite. Capillaries, these are the smallest blood vessels. This is where nutrients, gases, and waste can diffuse in and out. They're really thin, and then there's really small openings so materials can pass through. Some different exchanges happen here. Diffusion of gas from high to low. You have filtration. You have the lymph system, which returns excess fluid to the veins. That's just some extra material if you want to learn more about it. And as far as veins, you have venules. These are small veins that connect the capillaries to the veins. And then veins are the opposite. They carry blood back to the heart. They contain these little flap-like valves. They call them semilunar valves that keep the blood flowing from flowing backwards. Some different disorders that can happen. An aneurysm is a weak region where pressure forms a balloon and it can potentially rupture. And then varicose veins, you might have seen these a lot of times like on legs and stuff like that. They're abnormal dilations in veins, so they kind of like protrude from the skin in a way, like you can really notice them. The valves don't work properly, and it causes like the blood to sit there and pool. Blood pressure. So the arterial blood pressure, you have systolic pressure, which is the high number. Like when someone takes your blood pressure and stuff, that's the high number. When ventricles contract, that's the highest pressure in the system. The diastolic pressure is the low number. That's the lowest resting pressure in the system. And then they also check your pulse. That's the alternating expanding and shrinking of your arteries. And that's found at your wrist is where they usually take it. You can also do that at the side of the neck. And that's equal to your heart rate. When you are feeling that pulse, you're feeling the ventricular systole is what the proper science name for it is. Some factors that affect blood pressure. So stroke volume, that's the volume of blood discharged from a ventricle. And some of these are just extra, like if it's not bolded or underlined in your notes, you don't need to know the extra material, but it's good to kind of hear it and go over. The cardiac output, that's the stroke volume minus the heart rate. This increases the heart rate. And when we increase the heart rate, that increases the cardiac output. Viscosity is how thick the blood is. The thicker it is, the more force, blood pressure that's required to push it. When we decrease viscosity, we decrease the blood pressure. So you'll need to know that. Some different things to get control of that. They have different receptors that they can put in. They can increase or decrease the stroke volume or heart rate, things like that. So branches off of the aorta. So you have the brachiocephalic artery. That's the very first branch off the aorta. And it goes to your right arm and your right side of the head. And then the upper limb and the head, and it branches into that. And these are all on your diagrams too, but the right common carotid artery, that goes to your head and neck, and the right subclavian artery goes to your right arm. The left common carotid artery, that's the second branch off of the aorta. And then the aorta, you need to know, it has ascending, different parts of it, the ascending aortic arch and the descending aorta. You can see that on the diagrams too. So these are the diagrams of the arteries, or this is the diagram of the arteries of the head and neck. The head and trunk, I mean, is all of these. And then the arteries that supply the upper limb is all under here. And then the arteries that supply the lower limbs are all down here. So it's pointing to all of this. You guys will have a quiz on these. So this one, I mean, this quiz is probably going to be more difficult because there's so many different arteries and similar places and things like that. So make sure you guys start reviewing those. And those are also in your book too if you want like a bigger visual. And these are the veins. You can see all of those veins. We went through some of these names too. And if you look at the names of the veins, they're where a lot of different things are. So, or they're named by where they are. So that will help too. So some lifespan changes as you age, basically is what this is kind of going through. Blood pressure increases with age and your heart rate decreases. And exercise helps with like a lowered risk of heart disease and a lower blood pressure. CAD, or coronary artery disease, that reduces blood flow in the arteries. Some different symptoms: angina is the pain in the chest from your heart not getting enough oxygen. Some risk factors would be like smoking. Some things to do would be lower the fat, cholesterol, lower sodium, and make sure you exercise and reduce stress. You hear all of those things all the time. Angiogram, that's a little tube that they put in there that releases dye, which shows up on an x-ray where a blockage is. So that's a test that they can do. Number 5, angioplasty is a small balloon that they use, and it enlarges the vessel to open up the blood flow, but it's only about 50% successful. They can obviously put stents in. And coronary bypass surgery, they use a vein to bypass the area that's blocked or constricted. And I believe that is the end of the notes.